Sana first started, we were very focused on the technology, and at the heart of the organization is an open source telehealth platform that could be customized to address any clinical application. Basically, a cell phone could be used as a computer. You could embed decision trees. It could also interface with any hardware at the point of care to improve diagnostic capabilities. And at the same time, the cell phone transmits those information into a back-end electronic medical record system so that there is tracking to what is happening to the patient. Very quickly, we learned that technology is the easiest part of the puzzle, that seldom is technology alone sufficient to address the big issues in healthcare. One of the bigger problems that we encounter is the lack of this culture of quality improvement. And if the people on the ground don't appreciate what you're trying to do and are only drawn to the sexiness of the technology, typically we are not able to sustain or scale the innovation that we are introducing. So we stepped back and we said that we have to improve the educational piece. We have to have them understand the complexity of the problem that they are trying to solve, try to nurture this culture of quality improvement, and we think that those are requirements for us to be able to introduce any innovation that will help address the issues that they face. Our approach has been different from the previous centuries in that they are the ones who choose what problems are most relevant to them. They are at the heart of designing the solutions with our help. They are also the ones who raise the funding to be able to test the innovation that they have designed. We help them in terms of securing that funding either from their government or from a foundation, but in the end, they could see that they are the owners of the project. In that case, the accountability for success is so much higher, and they are more motivated to really make sure that they move on with the project. What we do is we partner up with universities in low and middle income countries. We specifically select computer science departments who are interested in software development. The focus of our digital health information systems is the use of cell phones, which are now ubiquitous, with 3 out of 4 adults owning one cell phone. And what we would like to do is to partner up those software developers with the local clinicians who are able to discuss and explain the intricacies of the problems that they face. The process is similar to the Datathon in that the clinicians again pitch problems at the start of the hackathon, and then during the weekend, with some help with our software developers, they learn about the Sana platform and they customize it for the clinical application that they are interested in. At the start of the year, for example, we were at Tec de Monterrey in Mexico City. The theme of the hackathon is providing health information systems to support the care of elderly people. And we had brought in a geriatrics program from one of the local hospitals, and they are the ones who provided some guidance in terms of the problems that they face in terms of caring for the elderly in the city. And the computer science and engineers from Tec de Monterrey teamed up with the geriatricians in Mexico City and came up with different ideas. And by the end of the hackathon, they had several prototypes that we are hoping to continue to mature over time. Some of the examples that came up from the hackathon include an application, for example, that will help an elderly patient with urinary incontinence in terms of guiding them through the exercises that are required for them to control the incontinence.